Okay, so after investigating for the complication, you are now going to investigate for the cause. And we've said that the cause can be treated with an increase in intra-abdominal pressure, where you can visualize it in the past history, where if you have multiple gestation, macrosomia, polyhydramnios, you can visualize that from the past history in the ANC of the patient. Now, the next thing is you can also visualize for increase for the cases of cervical. If you can visualize for the cases of cervical, if there is cervical insufficiency, is it clear, or there is fragilization of the membrane. So that fragilization of the membrane can be caused as a result of a cervicitis. Is it clear? This fragilization can be as a result of cervicitis. And now you need to know that what cervicitis can be of different etiology. We can have trichomonas vaginalis, trichomonas vaginalis, which can result to cervicitis, and the trichomonas vaginalis cervicitis is usually greenish in color. Is it clear? If you have trichomonas vaginalis cervicitis, it's going to be greenish in color. Now the next one is going to be as a result of chlamydia or other sexually transmitted infection. Chlamydia, when it is gonorrhea, chlamydia, or we have for mycoplasma hominis or ureaplasma urinaticum, the discharge is mostly going to be yellowish in color. Is it clear? And then the next one after the yellowish discharge in color, which coming from the chlamydia, the gonorrhea, the mycoplasma hominis, we also have discharge which is whitish and offensive like a fishy smell offensiveness. It is mostly as a result of bacterial vaginosis. Is it clear? As a result of bacterial vaginosis. And then the next one, it is going to be the case when it is whitish, thick like grease, and then it is associated with pruritus. It's mostly a result of candidiasis. Is it clear? So those are the different microorganisms that you have to know, and you have to know how to investigate for them. So now to investigate for trichomona, you just ask for microscopy, and on microscopy you are going to see, to investigate for trichomona, you just ask for microscopy, and microscopy you are going to see biflagellate microorganism, a biflagellate microorganism with 2 nuclei. Is it clear? That is going to tell you that there is a presence of trichomona vaginalis. To evaluate for chlamydia, you can just ask for chlamydia serology, where you are going to visualize IgG and IgM. The IgM is going to tell you an acute infection, while the IgG is going to tell you for a chronic infection. But we need to evaluate the point that generally the serology of chlamydia does not really help again very much in the diagnosis of chlamydia. So you can also go to other elements like culture and sensitivity, which can also help you to visualize for all this one: chlamydia, gonorrhea, and mycoplasma, or even ureaplasma urinaticum. But it's also very difficult to culture them. So the best investigation that you can have for this microorganism is called a nucleic acid amplification testing. A nucleic acid amplification test, which is called the NAT. Is it clear? A nucleic acid amplification testing. Is it clear? Now the next test that you have to do is for bacterial vaginosis. Now when you have bacterial vaginosis, you do also microscopy. Is it clear? And on the microscopy, you are going to visualize clue cells. Is it clear? Now actually clue cells is a cluster, is a big cluster of epithelial cells. So you have actually clusters of epithelial cells. Clue cells are clusters of epithelial cells. Is it clear? And those epithelial clusters have aggregations of bacteria around it. Is it clear? It has aggregations of bacteria around it. Is it clear? That's what is called clue cell. Is it clear? It is a cluster of epithelial cells which have aggregation of bacteria around it. And generally, the microorganism that causes bacterial vaginosis is multibacterial. Is it clear? And the major microorganisms associated with it are usually, you have Gardnerella vaginalis is the first one that is involved. The second one is the Bacteroides. You have Bacteroides, which is an anaerobe. The third one is Peptostreptococcus, which is also an anaerobe. The fourth one is fusiform bacterium. Is it clear? So those are the different microorganisms that you have associated with this, and these are the investigation that you do. Now, when you have a whitish, thick, greasy discharge which are associated with pruritus, you think of candidiasis. And to visualize for any fungi or any yeast cell, what you do is that you do a vaginal swab. You do a vaginal swab and you do microscopy with potassium hydroxide. When you do vaginal swab and microscopy with potassium hydroxide, and then you visualize either hyphae or yeast cells, is going to actually tell you that the patient is having candidiasis. Is it clear? So that is how you can investigate now for the cause. Now, the next thing to have to move on to is the management of a patient that has premature rupture of membrane.